Okay, thanks a lot. So this is my paper, which I'll be presenting with co-authors Matt, Gabe and Angus. And I'd like to begin firstly by thanking Uncle Frank for the welcome, but also to acknowledge that the Dja Dja Wurrung people, the traditional custodians of the land that I work and live on and where this work was conducted, and pay my respects to their elders past and present and extend that respect to any Aboriginal and Torres Strait Islander people here today. So this talk today is actually to do with two of my favourite things merged together. So the first is drug checking services, which we've heard just discussed there, and just to define them, they offer consumers the opportunity to submit drugs of concern to test their chemical content and purity. And this information is provided back alongside a tailored intervention. And the second thing I've been into a lot in the last decade is darknet markets or crypto markets. And these are digital marketplaces that host multiple sellers. They offer participants anonymity via their location on the Tor network and the use of cryptocurrencies like Bitcoin for payment. And they also aggregate and display customer feedback and ratings and comments. And due to this feature, it's been suggested that drugs sourced through crypto markets are less likely to be adulterated or substituted compared to drugs purchased through in-person networks, because this feature allows anonymous buyers to report back as to whether their drugs are problematic, and they can leave bad reviews. So this is one of the reasons why they might have an effect on adulteration. It's a little bit unknown. In terms of drug checking in Australia, there's been community-run drug checking via reagent testing for decades now. But as many of you would know, in Canberra in 2018, we had our first sanctioned drug checking service at Grooving the Moo, repeated again in the next year. And then there was the pandemic, after which we had Canberra's fixed site drug checking service open up halfway through 2022. Now, submissions there can be made in person in Canberra, although they do accept people from outside of Canberra if you arrive in person, and individual results can be provided verbally, but you're not allowed to sort of take them away or put them up on a website. So at the same time, Test for Pay, which I'm talking about today, actually launched. And this was an Australian darknet market community organised harm reduction program. So the buyers needed a place to send their samples. So they sent them to the Canadian-based service Get Your Drugs Tested, which accepts anonymous submissions. And the results are posted back to the Darknet Market Forum for community access. So Test for Pay a couple of months ago when I did these screenshots looked like this. So basically just a web forum on the darknet. And the individual results were essentially put forward what the substance was sold as, identified as, the purity, fentanyl test negative or positive, and the Get Your Drugs Tested reference code. And this is a screenshot of Get Your Drugs Tested, the website portal where people were submitting their drugs. So the aim of this project today, to introduce you to Test for Pay, but also to report on levels of drug adulteration and substitution within this sample of drugs purchased from Australian crypto markets over the last 12 months. So with the help of the ANU Cybercrime Observatory, we downloaded the DREAD subforum Test for Pay up until August of this year. And the posts that we included in the analysis had to have sold as information, and they had to have been sent to Get Your Drugs Tested. The service Get Your Drugs Tested uses infrared spectrometry plus strip tests for fentanyl and benzos. So there's a number of things they can't do in terms of limitations. And although we were able to verify the information via their database. And finally, we had to define adulterants. And as Amy knows, that's not easy. And in this particular study, we defined them as any substance detected that was not the advertised substance and was either psychoactive or had documented adverse health effects. But substances like lactose and glutamine, these were not considered adulterants for our purposes. Now, I don't expect you to read this table, but this is the table of results. The bottom line, you'll see 103 samples were included. 65% of those contained only the advertised substance, 14% contained the advertised substance in combination with either psychoactive or potentially harmful substances, and the remaining 21%, the advertised substance was completely absent, so substituted with something else. So in terms of the top 7 of those, in order of a number that we had, You can see here with this graph that MDMA, methamphetamine and heroin were entirely only the advertised substance. However, we had a number, 2CB was pretty bad there, and alprazolam, cocaine and ketamine contained a number of different substances. So only 1/5 of the cocaine samples contained solely cocaine. In terms of some of the further results, we found a number of different novel dissociatives sold as ketamine, including tiletamine and the ones on the screen. And cocaine, the cuts involved with cocaine were ones that we have seen in other studies, lidocaine, creatine, levacimab, and etc. Alprazolam, there are a number of novel benzos there. 2CB was strange. There was a number of dissociatives sold as 2CB, which was a little bit odd given it's a psychedelic. In terms of metanidazine, which you just heard a little bit about from Brendan, we had one sample that was actually supposed to be sold as metanidazine, and Get Your Drugs Tested found that it was probably a nitazine, but they couldn't actually identify it as metanidazine, so a bit unknown, but that was actually there in the samples. People could be buying that, of course, and off-selling it, so that's a concern in terms of what might be happening there. And luckily for us in Australia, all the samples were strip tested for fentanyl and none was detected, which is excellent. So as you can see, we had some adulterators and substitutions, some that would really elevate risk there. Some of these substances are very potent and have been associated with harm. Given that the data set was actually collected very similar time to the CAN-TEST information from the first 6 months of that service, looking at the results, 65% of test for pay samples were as expected versus 53% for CAN-TEST. And especially that last one, the expected absent was 21% versus 45% for CAN-TEST. We could conclude the darknet markets are less adulterated, but you can still see adulteration is rampant. The samples are not representative. It's only 100 samples, so hard to know. So despite their review systems, crypto markets are definitely not immune to these issues. And I think this demonstrates really neatly that darknet markets are embedded in larger drug market systems. They're not sort of sitting on their own. They have to get the drugs from somewhere. So these systems are more interrelated than is often thought about. There are numerous limitations. I'll have a little QR code at the end. You can look at the paper for more, as I know I'm running out of time. But I think the implications are that it shows we need local drug checking services that offer similar services that are accessible to this community. They don't want to do in person and they don't want verbal results only. They want to be able to share it with their peers in an independent way. It also shows ongoing monitoring of these sorts of communities is really useful. And I've actually been posting some of the alerts that Brendan put up earlier to the community, and they've responded really positively to those. It's new information to them. It demonstrates the need for safe and legal drug supply with regulated quality standards, but in the context of ongoing drug prohibition, it demonstrates an urgent need for more local drug checking services tailored to the needs of different kinds of communities, including these. So thank you for that. Now, this QR code is the full paper, which is currently under review, I should say. Nadine was great at her mentioning what's under review, but it is under review at the moment, but is available as a preprint from here. Thank you. Happy to answer any questions.
Thank you, Monica. No, we've got a hand up. We'll just wait for the microphone.
Thank you. Thanks, Monica. Really interesting stuff. And I suppose on the back of the other presentations as well, it just rams home the importance of a variety of methods, a variety of approaches. And I think what we've seen in New South Wales with the recent deaths has been, even all of the types of things that are being enacted right now are not necessarily enough. And so I just wanted to ask you, you've been around for a while, and I just wondered, how do we continue to obviously put pressure where we can and hopefully get a few things over the line in terms of policy, but also not forget that we need a variety of approaches. It's difficult to balance those things sometimes, and I just wonder what your thoughts are on that.
Oh, Susie, thanks for the comment. And I think one of the things people have asked me recently is how can we how can we make this happen? Like, what's missing? How can we make this happen? I feel like the question is, you know, we should be asking the politicians directly, you know, how many more people need to die? How many more coronial inquests do I need to attend and say the same thing and have the same coroner recommend the same thing? I don't know what that number is, but every time it happens, it's a pretty sad thing. So apart from keep going and don't give up, maybe someone like Simon, who's actually got some reforms through, might have some responses about what we should do. But, you know, I figure we should just not give up.
Thank you so much. Do we have any other questions for Monica? Oh yes, Simon.
I just had a quickie, Monica. Just when you at the beginning talked about, was it Australian dark web sites, or was it people in Australia who'd bought from sites which could be international sites? Can you just?
They were all Australian vendors. Yeah. Oh, wait a second. No, sorry. They were all Australian buyers. No, you're right. There were, but they were all, yeah. So essentially drugs that could be bought in Australia that were brought into Australia, but some of the vendors weren't Australian. Yeah. Yeah.
Great,
that
thank
right.
you. Oh, yep.
My question was similarly a point of clarification. So
Mm.
they're people in Australia with Australian IP addresses or something. Is that how they find them?
No. So how can I explain this? So anybody that was on the darknet markets, any darknet market, so they could have been buying from any vendor who managed to get that drug into Australia.
Into Australia, and then they had to get it out again to send it to Canada.
That's right. And they did that.
So this is a group of people that are prepared to take quite some risk.
It's
in
not
import,
much of a risk
export.
for them to send it out to Canada because yeah, definitely don't put your return address on it.
Oh.
Yeah. But yeah, feel free to look at the paper because we've written it all up and hopefully it explains it all. Yeah. Thank you.
Great. Thank you so much.